Low bone density or osteoporosis are often conditions that are talked about when talking about aging. But to talk about the prevalence and answer some of the questions regarding risk factors and even fractures, we are happy to welcome to our show today Dr. Cassandra Ricketts down there and Dr. Tara Sonnenstein, both from the Florida Orthopaedic Institute. Ladies, welcome to the show. How are you today?
Great.
Doing well. Thank you for having us.
I'm so glad we're having this conversation, and I feel like, when you are starting to, age, especially as women, these are some of the things that we hear we should look for. So, Dr. Sonnenstein, let's talk first. What are those risk factors? What do people need to be aware of as we are aging when it comes to this?
So, like you mentioned, age, is definitely a risk factor, especially over the age of 65. Being a woman, so it is more likely to be seen in women versus men, but men can get osteoporosis as well. Sometimes being thin, kind of a smaller body frame, and being underweight, that's actually a risk factor too.
Really?
And certain medications, if you've been taking steroid medications for a long time, that can actually work against your bone density. Chemotherapy, things like that, so pretty strong medications like that can put you at greater risk for osteoporosis.
When do you make that connection with this is something I'm concerned about, I have some of these risk factors, and then of course once you hear, yes, you do have low bone density or osteoporosis, what are those steps? How does the progression look, if you wouldn't mind?
Yeah, so, well, of course, if you develop a fracture, that's definitely a big warning sign that you could have osteoporosis.
Yeah.
So, if you break a wrist, you break your spine, a hip, anything like that, that's a huge red flag. Hopefully we're catching the osteoporosis before something like that happens, but it doesn't always play out like that. So definitely something to be concerned about. So
no kidding. And then of course, let's talk about the fractures. Is that a common thing? Dr. Ricketts, I want to bring you in the conversation here. When people do get fractures, how many times do you get to attribute it, to low bone density or osteoporosis?
Yeah, excellent question. So I'm an orthopedic trauma surgeon, so I treat primarily broken bones, also arthritis. It's one of the most common injuries we see. So if somebody, we typically think of a broken bone, a high impact, somebody, car accident, motorcycle, fall 10 feet. However, if you fall and you break your hip, that's considered what we call a fragility fracture. You automatically have that diagnosis of osteoporosis if you fall and break your hip, break your wrist, break your back. Those are the three most common. And so it's really important to, like Dr. Sonnenstein said, understand, I have osteoporosis. I have to treat this, of course, recover from this injury, but I need to prevent another one. So that's very important, and it's a high percentage of the injuries that I treat.
Wow. Okay, and it's interesting too, all of those, I feel so bad when you hear about the broken hips, and it's kind of like you're going into that path then of osteoporosis, like you were saying. So if someone's watching at home, and maybe they think they have some of the risk factors, they thankfully have not had a fracture yet, they have not seen a trauma surgeon like yourself yet, what do you say to them? Who should pick up the phone and call? Who should maybe go ahead and go to the website and learn more about how you are able to help before we get to that point?
Right, so if you have any of those risk factors, but starting with a DEXA scan, so that's really your way of diagnosing osteoporosis or osteopenia. Your primary care doctor can order that. We order those at Florida Orthopaedic Institute as well, and that's really where we're getting our answers as far as, what does the bone density look like. We're looking at actual measurements and treating from there.
And you know what I really appreciate? Just to be able to know that you are able to get that targeted help under one roof and be able to work with the doctors who specialize in bone care like yourselves. Thank you so much. I really appreciate you. And in fact, there is a bone health clinic. If you want to learn more information about that, there is the website, floridaortho.com, and also a phone number. And you can talk about bone health when you do pick up the phone. And also exciting news, there's a new Lakeland location for the Florida Orthopaedic Institute. If you want an appointment there, that's the phone number again. Ladies, thanks again for being with us.
Thank you.
Thank you.